Welcome to Weekly Digest, where we highlight the works of ministers of government as they push the administration's development agenda. The Ministry of Health rolled out the first COVID-19 pediatric vaccination program in Georgetown Region 4, providing the first dose of the Pfizer vaccine for children 5 to 11 years.
I think we had a very good exercise. We were able to vaccinate 153 children between the ages of 5 and 11. We also did other vaccination because the parents who accompanied the children, some of them got booster doses. And so we did another 51 doses in addition to the specific age group of 5 to 11. So I think it was a good exercise.
The exercise is conducted in collaboration with the Ministry of Education and will be conducted in all regions across the country.
The Ministry of Education would have sent out consent forms to the parents, and they have been able to collect a lot of those responses. So the schools where we have higher percentage of response that is positive, we are going to go into those schools and start vaccination.
Still on children, the registration process has begun for children with special needs to receive $100,000 per year following an announcement of President Dr. Mohamed Irfaan Ali. Solidifying government's stance on improving access to education, Minister of Local Government and Regional Development, Nigel Darmlal, distributed boxes of exercise books and pencils to schools along the Maikoni River.
As Minister of Local Government and Regional Development, my responsibility includes making sure that all the schools are in good condition and making sure that all the teachers have good facilities and amenities to teach you. Not because this school is way up the Maikoni River, it means that it must be left unattended. Our President Ali wants every school to be provided, or every school child to be provided the same opportunities. So just like the children in Georgetown, you must also in Gordon Table get the same opportunity.
Major infrastructural development continues in various communities along the Quarantine Corridor, Region 6, East Berbice Quarantine, fostering community development. Minister within the Ministry of Public Works, Deodat Indar, on Wednesday spearheaded inspections of ongoing works in the region.
Well, they're going to own it. They're going to own the infrastructure, and that when you're doing work in a community, community involvement is key. They're going to own it. They're going to care it because they know they had something to do with building of it. There's a sense of pride too. I personally say, I built that road. So something that we are encouraging, and we are actually fostering the development of the contractor's capability within the region.
To further assist the contractors, the ministry is providing some of the materials needed for capacity building to ensure quality work is delivered. Agriculture Minister Zulfikar Mustafa traveled to San Jose, Costa Rica to participate in several high-level engagements at the headquarters of the Inter-American Institute for Cooperation in Agriculture, ICA. Whilst there, Minister Mustafa met with Dr. Manuel Otero, Director General of ICA, to discuss technical cooperation agenda, supporting Guyana's rapid transformation, especially in the agriculture sector. He also held discussions with other officials on areas of mutual interest. In the education sector, Minister of Education Priya Manikchand revealed that more than 4,000 persons have applied at the Cyril Potter College of Education, CPCE. She said the education system is attracting more persons. This falls in line with the drive of government to train all teachers in the public education system. In line with this, hinterland students have begun arriving to attend the CPCE. Minister Manikchand has engaged the teachers who teach at special education needs schools across the country. The consultation was held in the conference center of the Cyril Potter College of Education, Turkine campus. The purpose of the consultation was to hear from teachers about what they believe the ministry can do to improve the SEN sector in terms of education delivery and the needs of students and the teachers. Minister Manikchand said that his special pathway program will commence in September at CPCE to train interested persons in becoming special education needs teachers. Meanwhile, the new ocean-going passenger and cargo ferry vessel, which will ply the Georgetown to Northwest District, was launched in Kolkata in India in the presence of Minister of Public Works Bishop Wan Edgell. The vessel, which is now about 60% completed, will be fitted out and tested over the next few months in Kolkata. Passengers arriving in Guyana from Saturday, June 18, are no longer required to have a negative PCR or antigen test. However, they are still required to show proof of vaccination.
Having looked at where we are in terms of vaccination, we felt very comfortable that we can now remove the requirement for antigen or PCR testing. However, we will still maintain, for travelers into Guyana, we'll still maintain that they have to produce their vaccination cards before they're allowed on the plane.
The removal of negative antigen or PCR test comes 2 years after it was implemented as a measure to prevent imported cases of the COVID-19. Since the start of the pandemic, Guyana recorded 82 imported cases of the disease. Dr. Anthony said the decision was made after evaluating the current situation in Guyana. Currently, 86.4% of the adult population is vaccinated with at least a first dose of a COVID-19 vaccine, while approximately 66.8% has had 2 doses, which Dr. Anthony noted is relatively high.
With vaccination, I think we are in a good position. Of course, now we want people to be coming for their boosters because that too is very important. Even if we have people who are positive, we have enough capacity to be able to treat people, whether they're in hospital. Because the Ocean View facility, we have 198 beds there. So if people get sick, we can deal with any surge. And in addition to that, at all our regional hospitals, we do have beds for COVID-19 patients.
Meanwhile, Dr. Frank Anthony also received a donation of personal protective equipment from the British High Commissioner to Guyana.
So I want on behalf of the government of Guyana to thank the UK government. It's not the first donation. We have received other donations from the UK government. We have also received vaccines, and so we are extremely grateful for these intervention, because with these intervention it allows us to strengthen our response here in Guyana. So once again, thank you very much.
Minister of Human Services and Social Security, Dr. Vindhya Prasad, announced that persons living with permanent disabilities will have access to public assistance for life.
All persons, all living with permanent disabilities will be able to access public assistance without any need to qualify, any means test. It's automatic access to public assistance. And secondly, that public assistance will be provided to them for the rest of their lives. They do not need to be subjected to any other medical or any other tests going forward.
Dr. Prasad said persons can liaise with the National Commission on Disability or with visiting teams across the country to register children for the government's $100,000 grant for special needs children.
And it will include persons who are living with HIV and those who have cancer.
More persons have access to shelters now that Minister Vindhya Prasad opened a newly constructed wing at the East Le Penitence Night Shelter in Georgetown. The minister said government is committed to ensuring persons at the shelter receive quality care. Suitable training programs will also be offered. 30 young persons of Region 6, East Berbice Carrickleen, have been allocated low-income homes at Ordnance Fort Lands as the government accelerates its national housing program. It is the first set of 100 two-bedroom flat homes currently under construction at Ordnance Fort Lands. Each unit measures 600 square feet and costs $5.5 million, inclusive of the cost for the land.
In the short period we are back in office, you would have seen the number 75, number 79 villages, right here, Ordnance Fort Lands, Williamsburg, Hampshire, you would have seen infrastructure work for allocations that were done by us and allocations that were done by the last government for which no infrastructure work was done. And despite what you may hear, we honored those allocations, and that's why we did the infrastructure work.
Attorney General and the Minister of Legal Affairs, Anil Nandlal, Senior Counsel, has made it clear that government is serious about constitutional reform. However, the opposition party is yet to submit their proposal on the construct of the committee after dates were set.
Today I tabled the government's proposal, which is that the government is submitting that this commission, Constitutional Reform Commission, be established by a law, that the members are to be appointed by His Excellency the President, that 50% of the membership shall come from the government side in the parliament and the opposition parliamentarians, and the other 50 shall come from civil society organizations, including the labor movement, the private sector commission, the religious organizations, Guyana Bar Association, farmers organizations, organizations representing women, and organizations representing youth. The chairperson of the commission is to be appointed by the President in the exercise of his own deliberate judgment.
That's it for this edition of Weekly Digest. For these and other government-related information, do log on to our website, dpi.gov.gy, and our social media platforms as well. Goodbye.